Imagine it is March 31st, I believe, 2022. We're going to be performing a sacroiliac joint fusion on the right side. We have Hello Kitty here assisting me and Dr. Patel as we perform this surgery. All right, this is going to be an open SI joint fusion with instrumentation. Incision. This patient has a painful right sacroiliac joint and they injured themselves at work. So I'll do my best to answer questions, but I'll need a bit more attention to do the surgery today. So enjoy the surgery. Feel free to ask questions. I'll try to answer them. We've just made our incision, kind of in the right lateral butt cheek, and I'm dissecting my way down. I don't need X-ray yet. We're going to be using an X-ray machine during the surgery. And I have a consultant here, a neurosurgeon who has a lot of experience doing these. He's going to be helping me do these procedures. Should I use a retractor, sir, or just leave it? Leave it for now, thank you. Wow. Yeah, right? I kind of feel like I'm doing general surgery again. Back in residency. I mean, I feel the fascia now.
Yeah, there you go. You can open that, it'll make it a little easier. Obviously, when you look at these people with the BMI that you got to worry about, right?
I don't know, do I?
Beyond the length of your dilator.
I see.
If the BMI was 40, I would just step into
Maybe do a bigger incision?
Yeah, you may hit.
Let's see our, no, I need the, yes, just this
Okay.
for now. And then, yeah, I'll need that in a second. Just let me have that. Parallel to the floor.
Okay.
Let's see where we are. Hold on. And shot. To anterior. So we need to go a bit more posterior shot. The what? Shot? Shot? Huh. All right. We're going to need to be quite a bit more posterior, huh? Yeah. Let me, so let me have the Bovie again. I think I needed to aim more posterior with my dissection here. All right, let me see a blunt tip one. Let me see the back of one of the original ones you gave me. Shot? Well, no, my hand's not there. Uh-huh. Yeah, I just want to get the tip in the right spot, then I'll drop my hand. So we're not far away. Shot? Shot, yep. Yeah, I'm just thinking. Let's just see shot. Too high, too cranial. Shot. 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 It's like pin the tail on the donkey. Shot.
Everything's very gentle.
Yeah.
That's gonna be bruised.
Yeah. No, I still have some fascia, which is holding me up. That's pretty good. Maybe shot.
A little bit here.
Yeah, a little bit more anterior.
I would even take that right on the elbow, but if you can go right here, it's inferior. and
Shot.
centimeter.
Yeah. All right. I feel. No. I have to put the right one in. So I just was using a blunt one so I can get an idea of where we need to be. Take that.
You get the hang of that. It takes a few takes to
Yeah.
subtle movement.
Shot. Let's see where we are here. So I just need to be a little bit posterior. Shot. Shot. Don't worry, I'll get the parallel to the floor. I got to get the tip in the right spot first, then I can drop it. Yes, it is. Shot. Well, a little more superior, right? I mean, a little more cranial. Yeah, I'm not worried about that, but the tip location,
If you can go a little bit,
little more cranial.
I think that would be it.
Shot. Shot. A little more anterior. Shot. 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 Too anterior, or you like that?
No, perfect.
All right, now I'm touching the bone, which is great. I'm going to drop this down. Not going to let it slide. No, I'm fine. Shot.
Go ahead and tap it a little.
Shot. Don't worry, I've got it. I've got it where I need it.
Tap it a little bit so it don't walk.
Now hold on. What do you think about that?
I like it.
Should I check the trajectory before I tap it?
No. Just
You-
dock it a little bit.
You like it where it is?
You can change the trajectory a little bit, just dock it. So you don't walk on the opposite. Kind of get that tip in as well.
Take it. Give me that. Shot.
Good. Remember,
It-
your part at the center of the bone.
I mean, I'm in the bone. You can hear it. Take it. Shot. Probably sliding just a little bit. Are you happy with that, or you want me to relocate it?
I'm okay with the tip. I'd like you to
To what?
bring this up. See, this is down here. I'd like it to be more like this.
Shot.
A little bit more.
Shot. Drop my hand.
Toward the,
Shot.
it's like this. You gotta
Shot. 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 Drop it. Drop my hand.
drop it in. Yes, get in there, sit.
Yeah, where do you want it?
Well,
Straight down the pipe?
you want a point. Okay, I would take that. You're supposed to point it to
Yeah, we're good. Now what? Now what?
I got this, but don't move. Get a good bite on the bone.
No, tap it in.
Yeah, he's right.
He's gonna use that and then this. Yeah.
It's got pretty big to it. Should be. It's not gonna move on it.
I don't know. I don't trust that it's not going to move on me.
Put it a little further.
Let's see where we are. Shot.
That'll work. We'll fit it, yeah.
Shot. Shot.
Put it in a centimeter or so.
was a little better. Now we're going to go to a inlet view. Huh? Just to verify? Inlet view. Watch the suction. All right. We're going to use these fluoro views to verify where we are and make sure our trajectory is good.
You remember that by in the bucket.
Yeah, I understand. Shot.
Straighten it out, please. Alright, so now if you notice, she's got some kind of abnormality here, okay?
Yep.
So we're gonna move
Aim.
this to something like this.
Aim caudally.
Yeah, so while you're looking at that, raise it lower a little bit so you see which way you want to move it when you do the drill.
Shot.
So there you go, see that? Perfect. It'll come right under this. Yeah?
Yep, I see it.
Alright, so that,
Now what?
now the outlet view, you're ready to work.
Go to the outlet view, please. Okay. Mallet. Mallet. Nope. He doesn't have it. I need it from you.
Equipment, you gotta get the view first.
I know that. I'm just preparing. Is that my picture? Yeah, I see the sacral foramen, I think. No, actually, that's not what I was seeing, but I don't know. I thought so. Go north a little bit. North, just a little bit.
I'm thinking this is it here.
Yeah, it could be.
I'm thinking this is the safe zone here. Let's see. See, I think that is, but we're gonna come in below. She's got this craziness here.
Yeah.
Here's the safe zone.
So you want me to aim lower?
Yeah, I would do your angle, bring it, I think this is the next parameter. Here's the joint, right?
Yep.
So go ahead, that's perfect, you're coming perfect. Come in just like that, see it? You'll hear the joint.
Shot.
You hear it?
I hear.
Hear the taper going forward?
You happy?
Keep going. You gotta go over here. See how hard that bone is at that joint?
It is hard. I'm happy with the progress. How about you?
No,
Huh?
you gotta go all the way to here.
No, I'm happy with the direction.
Oh, the direction's perfect. That's a hard joint that he's got. Listen to it very straight to the ankle. There you go. Keep going. Perfect. I would go right about there. A little more. Again more. Beautiful.
All right.
Very nice. Perfect.
Okay, do we want to check another view?
No, you're ready to go to your dialer.
All right.
You're ready to work.
So we're going to bring our dilators down next. If you notice, we do a lot of dilating here at Duke's Spine. Right? We use it in our shot. We use it in our laser surgery. I'm against bone. Next dilator.
Very good. Cranking right along here, Doctor.
I'm sorry? Yeah.
Cranking right along.
So if you can see what we're doing, I don't know if you can, but we're using a series of dilators that spread the tissue open. Shot.
There's your teeth, so you know your doc.
Yeah, I'm docked. I can feel it. Hold this, or actually screw in the back of this thing. The extension. It's up here.
You also want to measure your length of your tape.
Yeah, but I can screw this in first.
You can, yeah. Choose the order you want to use that.
Just let me get it in there. Wait, I got it. It's a little bent. All right, so will you just gently hold that? So I thought we used this with this big thing before, right?
You take your middle guy.
Take out the little guys out.
Take the little guy.
Yeah, I don't want to use the little guys. Take that. Patel, don't let this come out. Your job is solely to not let that back out. Slide that off, Luis.
I like the way you're holding on to your traction, your dialing on your thing. What are you reading here?
Between 30 and 35.
Take a 35. Here's why. When you put it in, 30 would be probably flush. If you leave it a little proud, if you ever have to come back, you can feel the end of the tape. You understand?
So I'm not going to put it all the way in. So 35. It's going to be 11 and a half by 35.
Right. Now you're ready for your drill.
Uh-huh.
How far do you know to drill?
I'm going to drill to 30.
35.
Now you want me to go all the way to 35?
It'll be
Yeah.
hard to get in with that bone otherwise.
Okay, let me off the end.
So go over that top. Dr. Patel, when you pull that drill out, you get real close to the end.
Watch your fingers.
So it's wire that's
Watch your... Shot. Here. Let me just think for a moment. That looks good. Shot. Why is my drill stuck? Shot. I don't want it to capture the pin.
no worries. It's not moving. Turn it on a little bit. I have a little preview block there.
Shot. Shot. You just soft tissue.
There you go. Now you're at the end. Now you're ready to go. Drill at 35.
No. All right. So I think we're good.
Right, you're fine. I can just take
Our tip of our pin is not moved.
this one won't move. This lower one that'll move on you.
Shot.
Bump so hard. That's perfect.
Shot. Shot. Shot.
Are you wanting to tap today?
I'm thinking, what do you want? Yeah, I'm thinking.
I'm thinking I put as hard as that bone.
Shot. Yep. I'll take your advice. All right, Bada, here's what I need you to do. I need you to hold this against the bone.
This one?
Yeah. There you go. Not too hard, but that's perfect. Shot.
There, big boy.
So the body's moving a little bit on the table. Either we push it back towards me or you move the floral. Shot. That's nice. My pin has not gone in further. I do see the hole though. Look at that. The foramen is a little below where I am.
Right on the top of where
Yeah. Shot.
You put that pin in exactly where it's supposed to.
I'm at 30.
Go to 35.
Are you spinning? Yeah, it's spinning. It's bringing the pin in.
It's okay. Are you at 35?
32. 3. 35.
Yes, I am. Yes.
You're gonna take it out now.
That's where we're at.
Picture.
And have Dr. Patel hold the wire back here in bed. So when you cut it out, it doesn't pull this out.
All right, so I'm going to back it up. Right?
Right, you back it out, he grabs the wire. As soon as that thing flares, you do.
You hold the wire. Don't let it go in any further. Shot.
He's gonna hold it.
Where's my shot? I need a shot. There we go.
He's using his hand. Dr. Patel, grab it right here. When he comes out with the drill, right at the tube.
Yeah, here it comes. Wait, the chuck separated from the bit. That's fine. Right? Hold that. I'm going to take the chuck and the drill separated.
And then just make sure he's still in the hole.
Now I'm going to take the bit out. Shot.
Good, everything's perfect.
Let me hold this.
Now you need your cap.
Hold on. I want to make sure this doesn't move at all. All right, you ready? Don't let this come back. We got bone graft here. You're gonna
Isn't that nice?
you're gonna save that, and we're gonna harvest it and put it in the screw.
Free autograph.
Okay, so tap.
Tap. You want to tap by hand on your first one. And later on, if you want to switch it to the,
It's the proper tap, 11 and a half.
yes, sir.
Me in the back.
It'll give you a feel for what a tap is.
Don't bend it.
This thing's very aggressive. If you put it on
I understand. I
beautiful, you're doing a wonderful job.
shot.
See this a little bit?
Yeah, are you happy with that?
Bring it in, I left your hand.
I don't understand what you're asking me to do.
The tube is pointing up like this. Is it?
Angle down to the feet. Yeah. That better?
Yeah. You'll feel that
I feel it engaging. Shot.
very aggressive.
How far? Across the joint?
Oh yeah, I would tap all the way to the
Shot.
all the way to the framing.
That far?
Yeah.
Why? If we only have one. I know, but if we only have one point of fixation, shouldn't I not over tap it?
No, you'll see. Remember, your pin is migrated a little bit, see it?
Yeah.
So you're gonna stop right here.
Shot. Are we past the joint? It looks like we're barely past the joint. Shot. Yeah.
See, it's good, you get it out now. Ready with the cage?
Could do some stem cells here.
11:35.
You may be able to get more bone off this.
Okay.
You can get some more bone here, Luis. Do not let that thing come off, all right? Now grab it there. You got it? Hold it in. No, do not let it come out, whatever you do.
Grab the net, you needed it. Hold that cage so it don't come off.
Now let me see where we are.
Fine, right on the edge of the parameter. Hold that cage for him so he gets it on the wire.
Yeah, help me with the cage.
Yeah. Do you want me to put it ready?
Yeah.
This is a team effort. There's a lot of hands being used in this operation.
There we go.
Okay, once you're on
And that's a 35 cage.
Sir, 11:35.
now you'll see how much easier this cage goes in.
Let me get in. Shot.
Beautiful.
Shot.
Walking it right along the line.
Shot. You guys getting the good X-ray pictures, Kevin? Shot.
Yes,
Shot.
sir.
See your laser mark on there?
Yes.
Yep. Take it all the way.
Take it to the laser mark.
Done.
It should be in right there.
Shot. That's it.
Okay, pull your wire back.
Pull your,
Second cage.
Pull the wire back.
just no, just pull it back a little bit. Shot.
For your final, so you're at the
Oh, hold it there. Don't let it move.
and you can come out and do the inserter now.
Hold on. I'm going to disengage.
Pull it up.
Let me, yeah, thank you. You're, nothing. I'm just taking the handle off first so we don't lose this shot. I went in a little bit too much. So you hold that wire, don't let it move. Shot.
There you go.
Take this.
Wire back so you get a nice picture. Now what I'm
Shot.
going to have you do, Arlo, because of her anatomy, you
Wait, wait. No, no, let me have it. Shot.
Good.
Shot.
I'm going to have you put the next wire in under freehand because of her.
I don't know what that means. What do you want me to do? Come out now?
I want you to come out with
Everything out. Everything out.
except for the wire.
Leave the wire. Blood pressure is good. Yep.
Okay, now bring the wire back.
You want to bring the wire back so that the tip of it. Shot. A little more. Right there. Inlet and lateral.
Maybe. I'm going to, because of her anatomy, we're going to see. I may have to do it freehand just to be safer. So this is our inlet view. Beautiful. Look at it. Right into the book guys. See it?
Yeah.
Could have gone a little longer with it. Huh? Actually, really, you need to go in further. See this?
Yeah.
So if you can re-engage, let's run
Okay.
it in a little further.
Let me have a screwdriver.
See why we leave that so you can see it's got all
Hold
your
that.
views.
Shot.
No, what do you do? Because look at here's the diameter, look at. That's gotta go all the way to here. Go ahead.
All right, I'm engaged.
From here to, this should be on the joint.
Shot.
Keep going.
Shot. That's beyond the joint. Shot.
See, we had a lot sticking out. Keep going.
Shot.
One more. Yeah, one.
Good.
Alright.
You happy?
Go back to the outlet view. Now you're perfect. This is
I'm
check.
coming here. Outlet view. All right, so at this point, the screw, you can see clearly on different views, it's past the joint.
Yeah, perfect. Okay. Coming right above it. See it?
Yeah.
Okay, that's good. Okay, now go to the lateral. You can take the instrument out. Use the wire.
Yeah,
Let's
grab
see
it
if we
there.
can do another one. This one. And what I'm concerned about are the block that you showed you yesterday.
I'm sorry, what?
I'm concerned about, you know, the block we used to measure the next screw.
Yes, too wide.
Anatomy might be, so we might want to just do like you did with the first one, you know, and pick a good spot for it, you know what I mean?
Oh, it's gonna affect it.
So let's look at how.
It might just be too close to the.
All right, hold on.
Go slowly down.
Hold on.
Why you don't go?
Hold on, hold on, hold on, hold on.
That's why we have things like this.
So we've had minimal blood loss. We've had probably 10 cc's at most, 5 to 10 cc's. I need the blunt one.
Yes, sir. Pretty good. Here's your anterior margin, the Johnson's bone.
Mm-hmm.
So what I would do, instead of using the block, go ahead and take the wire out.
Wire out.
Picture again. Let's try to get another one in right here.
All right,
So go ahead, just like you did with this one, try to pick a spot.
I will.
That's pretty good.
Shot. That should be on the screw. So I'm going to come back and shot. Shot. I'm going to have to take a different trajectory through the fascia. That's weird. It's like I went. Shot. 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 Shot.
Just a little bit down low.
You like that?
A little bit more inferior. It's got to have 16 millimeters.
All right. Let me have the pointy one. Let me have the pointy one.
Perfect case for surgery.
Yeah. Well, everything we do here is perfect for the surgery center. Shot. Shot. Shot.
A little bit high.
High, dorsal or cranial? Okay. Shot. Anterior. Shot.
I would take that.
Okay. You want to look down the pipe and make sure?
Just dock it and get a good picture of it. Squared away.
I just want to make sure we're all happy with that. Oh, slipping there. Shot. You happy with that?
Happy with that.
All right, dock it. Let's dock it.
And then get it parallel to the floor. That's how you dock it.
Take that. Be careful with the surface. Shot. Shot.
Yeah, I
Shot.
like that a lot. Yeah, perfect.
Shot.
Take that.
You like it?
Now, I would prefer, because you're a little bit posterior, you got it up like this a little bit. So let's just do this.
Yeah. I can do that.
The picture you had before this one. So that is something like this.
I understand. I think I'm there.
You can make that correction.
I think I'm there. Take this. I'll show you. Let's just make absolutely sure. Shot. Shot. Yes.
Well, I'm concerned.
Shot.
I don't know if we have space enough here. If I can see this more in this plane, let me know. I think it's okay. But
Shot. Shot.
that's about to take
Shot.
it a little bit.
Shot.
Yeah, okay, perfect. Thank you.
Yes, keep it.
You got from here, see to here, see?
Is that you want, is that the trajectory you want me to have?
I'd rather it be, right now you're like this.
Yes.
I'd rather it be a little more like this.
Shot. Good.
No?
My hand is up. Dorsal.
So down here, too.
Huh?
Move it,
You want me aiming with the tip more towards the feet?
I want you to move it superior, like this, and try that first.
Shot.
Once you're sitting down.
Shot. That?
Down just a little bit. Yeah.
Shot.
Little loose. Down a little more, just a little bit
Shot.
more. A little bit.
Down more?
Yeah.
Shot.
You're up like this. I'll take that. Take that. That's good.
Let's go to the outlet view.
And you'll see why. We're gonna put a smaller cage in here, but I'm trying to make sure that we don't bump cages. So
I understand.
Where I want it to go inferior. Good down.
Take.
Okay.
I feel like we're okay until we verify.
Does it feel pretty good down?
It's decent.
You got it?
Okay. Inlet, inlet. It's gonna be off just a little bit like this.
Actually, it is docked.
So we got one here, one here, so you're gonna see.
Yep.
That looks pretty good, see? A
understand.
across the joint, okay, outlet view.
You guys getting all these fluoro shots?
Yes, sir.
Is that guy talking? Okay, see now this is where you gotta think in 3D. Is that really on that or not?
No.
No, that's correct. So your cage is gonna look like they're gonna be bumping with each other,
Yep.
but you know you got them
Separated.
Right.
Happy?
I'm happy. You happy?
I'm happy.
Is everybody happy?
The people that need to be happy, I believe, are happy. Shot?
You'll tell when you get in if you're bumping the cage or not.
Shot? That's the joint.
Yep.
Shot? 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 And if people thought they freaked out about my endoscopic hammering,
So here's our first foramina, here's the second foramina, here, see it?
mm-hmm.
So you can go all the way get out of the cage. You're across the joint
I
now.
don't know, you don't think that's the foramen right in front of the tip?
I think this is the first foramina, here.
Alright.
Here's the second
Well,
foramina.
no, I think there's a foramen
No,
right
but
there.
that's
No,
far
no,
left.
yeah, circle it.
See where you're,
Circle it. Yes, that.
look at your pedicles over here.
Yeah. But I don't want to take a chance. Can't we just be happy with this right here?
I don't know if it's gonna be enough across the joint.
Alright.
Yeah, go ahead right up to it, okay.
Fine.
If that makes you happy.
That makes me happy.
Same thing there, good boy.
Alright.
Point fixation on there because of
Do you want to do the dilator first and then that?
The what?
The dilator first and then this, or?
It doesn't matter. You guys have Patel as the co-surgeon, right? No. I don't think so. He's not even scrubbed. He's the proctor. You just identify him as the proctor. Yeah. Yes, he's the stud muffin proctor. That's fine. That's perfect, right? We haven't had a stud muffin proctor here for a long time. All right, I'm on the bone. Yeah, I feel pretty good here. Everything's doing what it's supposed to do.
kind of staying out of the picture here.
It's kind of hard to do, isn't it? You're a big guy. You holding?
You got it down.
Shot. All right, hasn't moved.
You got the 9.5 drill now?
You have both of them?
Yeah, I need the measuring thing.
Measure.
It's
Remember you use
it's again between 30 and 35.
the small circle now?
Yeah. No, I'm using the big circle.
No, it's little circle.
No, it's the big circle.
Oh, no, yeah. That'll be okay, yeah.
It's close to 35.
35.
Yeah. 35. Yeah. Sorry about it. I got to do this. I'll let you do some more of the next one. That's okay. Mm.
Sometimes you'll get a little beat.
No, I haven't lost any blood actually.
Sometimes you'll get a little bony, lake in there.
I haven't had any blood loss on myself.
No, that's right. You?
I haven't lost any blood. The patient has lost a little bit.
Yeah, maybe you may have lost a little bit.
Shot. All right. All right. That looks good, right? You're happy? Aim it a little south. We're going to go to 35, right? Shot. We got to make sure that tip, Bada, you see the tip on the foramen?
Right.
Please make sure that doesn't. I don't feel the screw, by the way, which is good.
If you felt the screw, what would you do?
I would stop.
Well, what you can't do is this. Look at our. You can go like this. See what I'm saying? And move it away from it.
Sure.
You're in perfect shape.
Well, I would feel it on the entry, most likely. Sean? Sean? All right, Bada, will you hold this against the bone? Yeah.
If you follow the directions on the instrument, it's pretty foolproof.
Sean?
Now you're at the joint. See how hard it is?
It is hard.
Isn't that amazing how hard that joint is?
35.
There you go. Perfect. Look at right.
Hold that in. You gonna have some bone graft again?
Hold the wires. Don't come out.
Hold the wire. I got this. Got the wire shot?
There you go. Perfect.
I'm coming back. Want to disengage? Disengage the drill at the chuck, yeah. Pull it towards, no, push, yeah. And now grab let go of this, I'll hold this. Just disengage the chuck, and I'll separate the drill handle. You hold everything, you got it, all. Shot. Okay, and now we'll get this out. I'll just put it in. You got it? I mean, it's pretty hard bone. It's. What do you think? Should I tap?
I would.
Let's tap. Let's tap. Let's tap.
Push your wrists apart.
I don't care about my wrist. But we'll tap. This is the right size?
Yes, I'm 5.
No, it's not 9.5. 7.5.
No, 9.5. Next size cage.
I thought we were gonna do a small one.
We did. We did 11.5 first.
I thought we were gonna do like a tiny one.
No, we're gonna do it 9.5. You got plenty of room.
And I drilled for a 9.5. Oh,
Drilled for 9.5.
wow. Okay.
We're gonna get good fixation.
Sounds good to me. Yeah, this should be really good.
Plenty of room.
Shot. Shot.
Young bone is a little limit.
Yeah, don't let this go forward, all right? Go back just a little bit. Shot.
You decided where you want to go with it. You marked if you need a guide. After you do about 5 or 6 of these, you can probably cap under power after I do. Put the cage in under power.
Yeah, I don't have a problem doing that. But I agree with you. I'd rather go slower than faster. Just to make sure we get everything just perfect.
Very nice. Did a very good job with that.
Thank you. Grab the wire. Here you go, Luis. Here's some more bone. Got the wire? You focus on that wire. Don't let it move. Some more bone graft if you want it. Or a popsicle. Huh?
Yes, sir.
We're good. You ready, Patel? You wanna? All right, Luis, hold the cage. No, let it slides easier that way. Go ahead and set it on.
Yes, sir.
I get sick at the sight of blood, so I can't watch.
Coming down. So we've packed this, they call it a cage. Suppose it is. Let me in.
Do you want to pack it further?
No. I'm just telling the audience, Shot, that we pack it with bone. Shot. Any questions from the audience? Don't let this go any further. Shot.
Yes, we have a question from Alfred.
Shot. Right
And
there. Hold it.
Alfred is asking, will the patient be able to sit down after the operation?
Yeah. Patient will be able to sit down.
Patient will have no limitations after the operation.
Shot.
Perfect.
Stop there.
I would go for the, see this?
Shot.
Yeah, okay.
Okay.
I really think we can
So leave the thing in, the guide wire in, right?
So what I would do is take this, the big thing out, leave your guide wire in, put your trumpet over the guide wire. Okay, pull your guide wire out, and then you can have a trumpet.
So take the driver out, take the
Tube out first.
tube out. Leave the driver engaged?
Take the driver out.
No. Okay. You got that one.
Little experience with everything.
Yep.
So
Shot.
it should still be in, right? Okay. Take your tube out.
Here, Luis.
Now give him the trumpet.
Give me the trumpet, please. Stay, keep the wire.
The trumpet and take out your wire. Go all the way until you feel it engaged to feel it.
Nope.
Picture. See the little.
I'm not sure why it won't engage.
Barely engaged.
I can't get it to engage.
You bring it up a little bit like this, the wire. Up. Because it's aiming down like that.
No, I can't get the trumpet to.
Can't get it engaged.
You sure it engages?
Oh yeah.
The back of the screw. Yeah?
Picture. So it's close enough. Hold
Okay.
the trumpet still, take the wire out, give it some bone graft. Pack it with the thread.
Just a little bit of graft.
So, give me experience.
Hang on, let me have it this.
Now it qualifies under code 80.
Code 80. Shot.
There you go.
Shot.
Now you can take everything out. Final picture.
Huh? Yeah.
Feel this with your finger?
Uh-huh.
Pretty deep, I don't know.
Really deep.
Yeah.
Uh-huh. I feel it. Shot.
That's a final outlet, now you need a final inlet and a ladder.
That's what I call getting fingered. Here, I don't know where to put that. You want to put it in? All right, you guys got these X-ray pictures recorded? Looks
Yes, sir.
really good.
Now lateral.
Get a lateral view? Go ahead, Dr. Patel. Start
Third
injecting.
anatomy, Tom Casey did a great job.
Oh, you did a great job. If I did a great job, it means you did a great job, right? Pretty cool. Yeah. I think they're both perfect. We lost 20 cc's. We'll be closed in 15 minutes. Let's get some suture. Yeah, it was good. Yeah, well, who knows? I think we should do more SI joint fusions. More SI joint fusions. How many SI joints do we treat a year? 1,000.
I was doing, when I left SSM, I was doing about 75 a year.
Fusions. You were doing 75 SI joint fusion? Yeah. Yeah, we do a lot of conservative treatment on the SI joints.
You're so glad to have somebody to feed them to help.
The pain guys?
But make sure,
Oh, yeah.
when you, in your chart, when you do an injection,
Hold that.
you document that they have a 60 or 70% improvement. Yeah. Even for one day, just as long as you write that, then the insurance company will approve it.
60, not 80.
I'm sorry?
60 is okay,
60 is okay.
not 80.
Well, it depends which insurance company.
Right, right.
The more the better, but Gotta have that in the record.
I'm doing a deep layer first. Huh? Well, I'm going to close the deep, and then I'll close one more more superficial layer. Thank you. Yeah, I was really happy with the purchase. Happy with the position.
That is some tough bone and tough anatomy.
Yeah, no, it's good. I'm glad her bone is strong, you know. She's got nice strong bone. I was worried maybe some osteoporosis, but there is none. And we had Hello Kitty watching me the whole time. I'm done with that. I need scissor.
Alright, I'm gonna go change.
Go change. Thank you. What time's your flight?
3:30 in Orlando.
Nice.
Nice meeting all of you.
Yes. Thank you, sir, for your time. Thank you. Same here. Thank you for
Rest
coming.
you all a very nice group. Thank you, fellas.
Well, stay in touch if you decide you want to come live and work in Melbourne.
Oh, the girls tell me I can't work here if I want. Louis
Why?
said I don't belong here.
Really? You like pizza?
I love pizza.
Then you belong here.
Hans told me don't even think about it.
Pizza and Mexican food.
No, that's not pizza. I'm full Italian, man. I'd get thrown out in the Italian union if I ate a pizza there.
You want to do this? You want me to do this? You can go. You have clinic, right?
Yes.
Why don't you go to clinic? Thank you.
No problem.
Good job.
Thank you.
Real sharp.
All right. So, I think I answered the question for the viewer that yes, she'll be able to sit after this. Sit and walk. We want our patients to be as active as possible from day zero. Sometimes it depends on, the quality of the bone. The quality of her bone was excellent. She has strong bone, so I feel that the implants will hold well and should not get loose with activities. We got a fair amount of bone graft in. Both cages were packed substantially, and surgery went very well. Any other questions? So for those of you watching, this surgery is a final step to treat medically refractory sacroiliac joint pain. It's not a first treatment. It shouldn't be a first line treatment. It should always be reserved as a last line treatment, and that's what we did here. This patient had injections of the SI joint and therapy, all of which gave her great relief, but only temporary. The pain kept coming back, within a few months. So at that point, you don't want to be doing steroid injections your whole life. So you want to get some type of let me try one more. Oh, never mind. We're good. We're good. Yeah. I didn't know if you, here, take this. So we're not using a drain. I don't think a drain's necessary. Some doctors will use a drain. Luis, you got the staples?
Yes, sir.
Let me get the eye band off. Sorry, I'll get the eye band off for you.
Yes, sir.
Let me have a pickup, and then you can do the staples. All right. So for those of you who can see this, this is an open SI joint fusion. We put 2 cages. This patient has had sacroiliac joint dysfunction, pain since her accident. She's a nurse, I can tell you that, and she injured herself on the job, and she has been treated conservatively for a while, and that just wasn't working, giving her long-term relief. So we always have fusion available as an option when you have a painful joint, and that's what she elected for, and we felt it was appropriate, so that's what we're doing today. Now this commemorates the first SI joint fusion done at Duke Spine Institute in our surgery center. They're done all over the world at this point. We're not the first people to do this. This is an established surgery. It's been around for years. And I had another surgeon, neurosurgeon, come and help me just to keep an eye on us and make sure everything was going perfect. You know, it's better to have an extra set of experienced eyes watching, and that's what we did. Any other questions? Good job. Go ahead and type up your questions and I'll come answer them for you. This is a right sacroiliac joint fusion. Luis, great job. You can see Hello Kitty is very happy. Any questions right now? Whose lead is this? Can we move this, please?
Yes, we have a question from Alexandria on Facebook. She's asking, do you use the corner lock method or a different one?
I'm sorry, do I use what?
The corner lock method or a different method?
That's a great question. I don't know the answer. A corner lock method. I'm going to have to familiarize myself with what the corner lock method is. But basically, we put two cages, screw cages, across the joint. They're filled with bone graft from the patient's own bone and a little bit of demineralized bone matrix. So, I don't know if that's the corner lock method. I'd have to get familiar with that. That's a great question. I just don't know the answer. I'm going to call our blood loss 15 mil. No complications. This was a right SI joint instrumented fusion. Any other questions? If you have other questions, please type them up for me. I'll come and answer them for you live. I'll be right there in a few minutes. Just give me a couple of minutes. Why don't we run a little commercial video testimonial until I get there. Dr. Ardic Majan here at Duke Spine Institute. It's Groundhog Day, I believe, right? February 2nd, so 2/2/2022. And I'm here with one of my patients who traveled from, where did you come from?
Tennessee.
Tennessee. And why would you travel from Tennessee to Florida to Duke Spine Institute?
I have been miserable for months, and I found you and did a consult with you and knew this is where I needed to come for good treatment and relief.
And what kind of problem were you having that brought you to Duke Spine Institute?
Severe lower back pain, which turned into sciatica, and it was down my left leg constantly. I slept about 2-3 hours a night at most, and I could not sit for more than 5 minutes, and I had to be standing up.
And did you try some other treatments in Tennessee or elsewhere?
I did. When this whole thing started and it was a bad flare, I thought I'll be able to work through this. Chiropractic, physical therapy, 2 spinal injections, massage therapy.
And how did you know those treatments did not work for you?
I had no relief at all. My sleeping continued to get worse, and my pain was never better.
And do you have relief now?
Absolutely. I would say I have 95% relief.
Awesome.
And it's amazing. After surgery yesterday, I put on a back brace. I walked out of here. I sat down yesterday for probably over an hour and had lunch. Last night, in bed, I had zero pain. It's a miracle.
Well, we're very happy that you're doing so well. And your surgery was a great one because we fixed 2 discs. You had herniated disc at L45, L5S1. And you can see in this footage right here that we grabbed the herniation out. And it was one of the herniations was really big. And it was really gratifying to get it out because it was resting on your sciatic nerve. Once we took it out, I think your sciatic nerve probably felt a sigh of relief.
Yes, absolutely.
Yeah, and the surgery went very well. The laser debridement of the annulus went well. And I feel like your pain's going to be gone. It's not going to come back.
I would agree.
All right, very good. Well, is there anything else you want to tell your viewers?
Folks, if you're suffering and you're not getting relief from those non-invasive therapies, then come see Dr. Duke and have him look at your MRI and give a good diagnosis. And
There you go. And then see, like, there's a, see this little thing? Just move the camera around until that's hidden. That little light on the side is gonna go away once we turn lights on. See? That's fine. They can't see us. Oh, they can, actually. Sorry, guys.
Dr. R. Duke Machen here at Duke Spine Institute. It's Groundhog Day, I believe, right? February 2nd, so 2/2/2022. And I'm here with one of my patients who traveled from, where did you come from?
Tennessee.
Tennessee. And why would you travel from Tennessee to Florida to Duke Spine Institute?
I have been miserable for months, and I found you and did a consult with you and knew this is where I needed to come for good treatment and relief.
And what kind of problem were you having that brought you to Duke Spine Institute?
Severe lower back pain, which turned into sciatica, and it was down my left leg constantly. I slept about 2-3 hours a night at most, and I could not sit for more than 5 minutes, and I had to be standing up.
And did you try some other treatments in Tennessee or elsewhere?
I did. When this whole thing started and it was a bad flare, I thought I'll be able to work through this. Chiropractic, physical therapy, 2 spinal injections, massage therapy.
And how did you know those treatments did not work for you?
I had no relief at all. My sleeping continued to get worse, and my pain was never better.
And do you have relief now?
Absolutely. I would say I have 95% relief.
Awesome.
And it's amazing. After surgery yesterday, I put on a back brace. I walked out of here. I sat down yesterday for probably over an hour and had lunch. Last night, in bed, I had 0 pain. It's a miracle.
Well, we're very happy that you're doing so well. And your surgery was a great one because we fixed 2 discs. You had herniated disc at L45, L5S1, and you can see in this footage right here that we grabbed the herniation out, and it was one of the herniations was really big, and it was really gratifying to get it off because it was resting on your sciatic nerve. Once we took it out, I think your sciatic nerve probably felt a sigh of relief.
Yes, absolutely.
Yeah, and the surgery went very well. The laser debridement of the annulus went well, and I feel like your pain's going to be gone. It's not going to come back.
I would agree.
All right, very good. Well, is there anything else you want to tell your viewers?
Folks, if you're suffering and you're not getting relief from those non-invasive therapies, then come see Dr. Duke and have him look at your MRI and give a good diagnosis. And if you need to have surgery, you come down here. He will take good care of you, and so will his team.
I really appreciate that. Thank you so much.
Thank you.
I'm Dr. R. Duke Machen. It's January 20th.
You get that thing. You get that thing.
Can I talk?
Yeah.
All right. Well, I guess we're streaming live. I'm Dr. Duke Machen. We just finished the right sacroiliac joint fusion. And if you've been following us for a few years, you know that we have not done one of them before, broadcast one of them before from the Duke Spine Institute, but it seems to be a good technique. It's proven itself over the years to be quite helpful to many patients. So what it treats, though, just so everybody understands, is this is the spine here, and this area of the spine is the lumbar spine, and this is the pelvis in here. And so, of course, the intestines and all, and bladder and reproductive organs are all down here. Okay, you all recognize that. So sometimes there are patients that get pain in, it's a bit overexposed, huh? I wonder if we could turn this down a little bit. It doesn't really help, but anyway, turn this ring light down.
Yes, sir.
The intensity maybe is just a little bit too bright. That's pretty good. Yeah, okay, that's better. All right. So anyway, long story short, maybe you can see this little crack right here. That is the sacroiliac joint. It's where the sacrum or tailbone connects to the iliac bone here. And so that's what we fused today. And the way we do it is, if you look here, there's the backside, there's a connection there. We went through here and basically bolted the iliac bone to the sacrum by going through this area and putting in 2 bolts, kind of where these 2 pins are. Okay, and to do that we had to use the X-ray view. We had one X-ray view like this, we had another X-ray view like this, and then we had another X-ray view from the side called the lateral view. And we went back and forth between those views, and we basically put in 2 bolts. We call them cages in the business, and those bolts are holding now the sacrum and the iliac bone together. So there's no more movement between the sacrum and the iliac bone. Normally there's only about 1 or 2 degrees of movement, but that movement, that little bit of movement, can be so painful. And if you saw this patient, she walked in today barely able to walk, just hobbling in, just totally incapacitated with pain. And all of her pain was coming out of that SI joint on the right side. We know that because A, the location of her pain, we could see it topographically on her body, but B, more importantly, we did shots in that SI joint and the shot took the pain away. So if you put numbing medicine in the SI joint, takes the pain away, that means the patient's pain's coming from the sacroiliac joint. That's exactly what we did with Dr. Patel in his clinic, and she had that done a couple of times and she had great relief. So we knew the SI joint was the source of the pain. She just couldn't get better with the conservative treatment, so we kicked it up a notch to fusion. And we just finished that surgery and it went really well. We didn't have any complications. We lost about 15 milliliters of blood. And yeah, so we'll take any questions that our audience has.
No further questions.
You asked me a question.
The 2 screws. I left the screws. That's kind of about the screws.
How many screws are you placing?
Yeah, speak a little louder.
Okay. How many screws are you placing?
The question from our audience came from
Phil Larson on Facebook.
Phil Larson on Facebook. Thank you, Phil. We placed 2 screws today. Some surgeons will place 1, some will place 2, some will place 3. So just so we really didn't talk much about it, but this particular patient had a very narrow space between the joint. The joint was very, very narrow. So we could only get 2 screws safely in. And some patients have like a bigger SI joint, and that you can put 3 screws in, but we could not get 3. We got 1 in. The first one in went in really good, really solid purchase, really strong. We checked it out on all the views. It was perfect. And you know, sometimes I might think about stopping at 1 screw, just because if you try to cram too many into a small space, you can get a fracture of the bone, or you can get, you know, what we call an insufficiency fracture of the sacrum, and in which case that would make matters a lot worse. So you can do too much if you're not careful, but the reason I put 2 screws in today was because she has really strong bone and no osteoporosis that I could tell of in that joint. It was really solid purchase, and there was enough room to get a 2nd screw in. So I put the largest screw and the 2nd largest screw available from this kit. Any other questions?
No further questions.
All right, so that's it on questions. I hope you enjoyed this right sacroiliac joint fusion. I'm Dr. Ara Dukmajian with the Duke Spine Institute, and we do all of our surgeries outpatient. Nobody goes to the hospital. Everyone goes home within an hour or 2 of their surgery. We're typically known as leaders in the world in endoscopic surgery and laser spine surgery. But today we did a fusion on a patient who the laser surgery was not going to work for, so we ended up fusing her. Hope you enjoyed the surgery, and we'll probably see the patient back tomorrow and maybe even get a good testimonial video from her. If she's doing well and she wants to do a testimonial, we'll be able to publish that. All right, have a nice day. We'll be back in about 45 minutes with our next surgery, which will be a cervical Duke laser disc repair. This patient has 4, count them, 4 herniated discs in his neck. And you know, he does not want fusion. So basically he asked me to do the laser surgery at 4 discs. I felt it's reasonable. Now he does have a pretty thick neck, so, and a high collarbone, so we're going to see if I can get all 4. But should be able to get hopefully at least 3. So we'll see. Have a nice day if you can't make it for that. And what's our last surgery for the day? It's a lumbar?
It's a lumbar, yes.
And we have our last surgery will be a lumbar laser surgery, endoscopic laser spine surgery. All right, enjoy.